Welcome back to the BioNexus Health Podcast series. Today, many have asked me to speak a little bit about vitamin C. So it's going to be a nice and short podcast, and I'll be giving you some additional information on vitamin C. Okay, so let's begin at the beginning, shall we?
Welcome to the BioNexus Health Podcast with Dr. Jody A. Dashore, who holds a PhD in integrative medicine, is board certified in integrative pediatrics, an internationally recognized pioneering clinician, and author. And now here's your host of BioNexus Health Podcast, Dr. Jody A. Dashore.
I remember researching a lot on vitamin C for Brian when he was unwell, because we were dealing with a lot of inflammation in Brian's body. We were dealing with the mold exposure, with Lyme disease, with a lot of gut issues. So there was overall systemic inflammation. And one thing that we found very useful, I did a lot of research and I decided to go for vitamin C IVs. Intravenous vitamin C, we started with 25,000 grams. Intravenous vitamin C once a week. We gradually moved up, from 25 to 50,000. From 50,000, we moved up to 100,000 once a week is what we did for a few months. And we saw a lot of benefit with pain relief, with brain fog relief, and overall activity and energy levels, because, like I said, we were dealing with a lot of systemic inflammation, right? Not everybody needs vitamin C at that level, but this is something that I wanted to relate back to my experiences. Most of you want to know what my experience has been. It was very interesting. I mean, obviously, I did not want to continue something forever. Remember, the one thing that I say is that too much of a good thing is not a good thing. We had learned this lesson already when Brian had started losing, 1 pound a day, about a year and a half prior to my research into vitamin C. But the main reason for doing the IVC was inflammation and pain. It was interesting, I decided to try the IV vitamin C myself the one time, just tried it the one time. And it was most definitely helpful with systemic inflammation, aches and pains, and just feeling energized, like I said. So that was, I just tried it once just to see, I always try things before I give anything to Brian. It's just, a habit. I think many of you moms also do the same, but anyways, all right. So that's where I started learning, and I got some experience on the benefits of good quality vitamin C. Now, what we also did was, for myself, before and after removing amalgams, right, having the mouth detoxed and all the amalgams removed, I had about 5 or 6 of them that we had removed. I wasn't comfortable with having oxygen mask in my face at the same time that my biodentist was actually removing and replacing the amalgams. It was kind of hard. So we decided to go, I started feeling, anxiety and claustrophobia. So we decided to go with good detoxification before, as well as antioxidant, anti-inflammatory therapy with vitamin C before and after. So that kind of worked out really well for me. And then, I have a hyperbaric chamber that many of you may have seen. So I did do a little bit of hyperbaric chamber as well for a few days. And then, infrared sauna was something I did. So overall, vitamin C has been in my family's repertoire for a while. Now, Brian had FMT, right? So for that, you need anesthesia. Then we did a couple times, we did colonoscopies, endoscopies. In hindsight, absolutely unnecessary and useless. But, back in the day, we were trying everything that we could, to help him. And after these procedures, I just made sure that we did vitamin C, because one of the important benefits that I found was it helps with the physiological changes in the body that are brought about with significant levels of stress. So, okay. One other thing was we also had a lot of combination of vitamin C with curcumin, because we had a lot of gut inflammation, especially the marker CRP, right? CRP levels for Brian were pretty high. So along with that's the reason why, I wanted to do something urgent and quick to bring the CRP levels down. And that's the reason why I chose a couple of months of intravenous vitamin C. I don't think it was 3. I think it was 2 months. And of those 2 months, we actually missed a couple weeks, or I took conscious breaks for a couple weeks, right? Just to see, if additional is needed, or it's always important when you're doing such bulk doses or intensive therapies to kind of consciously take breaks to see if that's really needed, or if the body is kind of balanced. But with the breaks, I got the information that no, I do need to continue for a couple more weeks. So I think overall it was 6 weeks in a period of 2 months. Yeah. Overall we did 6 weeks. But anyways, so combination of curcumin and very high doses of vitamin C, we saw Brian's CRP levels come down. I remember reading in the Journal of Phytotherapy Research about curcumin and CRP and vitamin C connection. So we tried that, but that was quite beneficial. Okay, now, what is the best way to get vitamin C into your body? Well, the best way to get vitamin C in your body is to eat whole food sources that naturally contain the nutrient, right? So now keep in mind, and of course, one of the reasons why I'm speaking of vitamin C is because I did a recent podcast on cold and flu, and many people up their dosage of vitamin C during the cold season as a preventive, as an immune support, and that's great. So I thought, I should do a follow-up podcast, since many have asked about the best sources of vitamin C and any additional related information as well. So, right. Coming back to whole food sources, keep in mind that only natural, obviously organic is the best, but fresh, raw fruits and vegetables have a significant amount of vitamin C in them. That's because vitamin C is damaged by heat. So cooking fruits and vegetables lowers their vitamin C levels. In addition, long-term storage of fruits and vegetables also lowers the vitamin C levels. So it's best to eat fruits and vegetables fresh as you can get. I live in a northern climate. For approximately half the year, what happens is fruits and vegetables have to be shipped from warmer climates. So by the time that produce makes its way to my house, to my kitchen, it has already lost a significant amount of vitamin C. Therefore, it is best for people like myself, in the kind of climate that I live in, to eat fruits and vegetables when they are grown locally as much as possible. I've got an excellent arrangement with, as you guys know, I have my farm in Pennsylvania. So that region is beautiful. It's fertile. There are a lot of organic farms. So we have that connection here, and I try to eat in season as much as possible. And, try to eat fruits and vegetables grown locally in that way. Now, another thing to consider is that exposure to pollution for the human body leads to oxidative stress, right? I mean, unfortunately, over the last, 50 years almost, our toxic load, daily exposure to toxins has been steadily increasing. Now, that's another place where vitamin C requirements have actually increased. So for this reason, it's important that everyone have an adequate supply of vitamin C in their body, always from natural food, from your diet. Your diet is the best way to consume vitamin C. Remember, our bodies cannot manufacture vitamin C on their own. It has to be ingested in diet with food, right? Or supplement form. Now, supplements, you can't take supplements for everything, but if you, now during our consultation, if I have determined that you need, a stronger supplementation of vitamin C based on your labs, then I will advise you of the same. But until then, it's best if it comes through diet, right? Every cell in the body requires vitamin C. And during times of stress, acute illness, chronic illness, PANS, PANDAS, flare, cold, flu, any kind of procedures, right? Surgical procedures, anesthesia, big heavy duty dental procedures, right? Many children on the spectrum, it is very challenging to maintain any kind of dental hygiene. So often families schedule one big visit to the dentist that is under sedation or under anesthesia. Can be very stressful for the child. So that's when, make sure that you are doubling up on those beautiful smoothies. I've given many of you recipes for the smoothies, right? And if you did not write it down, remind me during your appointments. I certainly will. I'll give you one example towards the end of this podcast, right? So, what was I saying? Yes. So during times of stress, it's best to maintain and increase those vitamin C levels so the body can combat such a high level of stress. Okay. Now, anywhere from, once again, my research, I had read a study which talked about 3,000 milligrams to 5,000 milligrams, right? So 3,000 milligrams is 3 grams to 5 grams per day of vitamin C can saturate your red and white blood cells. So for some people, now this is for adults. So for some people, that's a good baseline dose based on that study, right? Now, others, younger people will need lower doses. Now, how can you determine what is the best dose for you during stressful times, right? I mean, higher, between 3 and 5 grams is great. But what happens is one potential side effect of oral dosing is loose stools. So if you get loose stools, simply lower the dosage, which will solve the problem, and it will also give you your baseline dose, right? Now, additionally, the other option is using smoothies and food sources and food and dietary sources of vitamin C. That works as well. I mean, you don't need to spend a lot of money on any fancy form, right? Simple vitamin C is great. Simple, clean source of vitamin C. Here in the US, we do have organic sources available. Now, the one that's in the store, in the BioNexus dispensary store, is buffered, right? So the reason for that is, buffered vitamin C is best used if a person has gastrointestinal gut sensitivity. So which is almost, 80 to 90% of my patients. So that's the best form that I have in the store, right? So vitamin C deficiency is possible, which is why when we look at your test results, if vitamin C is deficient, we may add some, or if I feel that, looking at the amount of deficiency, if I feel that getting that through diet would be the best, I usually advise you on that, right? So that is something, during COVID, because it was such a heavy duty stress on the body, right? My patients, myself, my family as well, we did easily 3,000 for Brian and 5,000 milligrams, which means 3 grams and 5 grams for adults, 3 grams for Brian and 5 grams for myself. We did that every single day for 1 week. We got a little bit of loose stools, but you know what? It wasn't bad because the vitamin C that we were ingesting was actually getting used up, right? Because there was an acute crisis with COVID. So just to give you an example there. So I'm happy to discuss this again at your specific appointments. But is it okay to do vitamin C every day during the cold season? How much should we do? Yes. 1,000 milligrams, mg, is good dosage for all age groups. Buffered is great. And regarding natural sources, fruits, vegetables, making a smoothie. So remember, fruits and vegetables, keep them raw. Now, those of you who are on my specific anti-inflammatory and, autism diet, you know that all fruits and vegetables need to be peeled if possible. I mean, I'm not saying peeled strawberries, but they have to be organic. If not organic, then washed specifically the way I have told you that the vegetables and fruits need to be washed. So we maximize the removal of pesticides and herbicides, try to get them as clean as possible. And what else? Yes, peeled, washed, organic, and try to get them blanched, right? You don't have to cook it. Blanching, look up the meaning of blanching. Blanching literally means, get some filtered water, bring it to a boil, and you immerse the fruits and vegetables in there for about 20 to 30 seconds, just so that they are very, very gently softened. Okay, so it's not 100% raw. Now, this is for people that I have on that specific diet. If I don't have you on that specific diet, then it's okay to do raw. But again, you can ask me at your appointments. But yeah, so that's called blanching. Blanching is great. Blanching is healthy for everyone. So if you're in doubt, go ahead and blanch. Sure, not everything is going to be great blanched, right? I mean, blanching strawberries, blueberries, it softens them a little bit, but not bad. All right, so quickly, let me give you a smoothie recipe that I like. Let's see, I grow my own microgreens. So microgreens are awesome. They are a great source of nutrition. So we do 1 cup, 1 bunch. Cups and all, I'm not good with that kind of exact measurements, but let's take a bunch of microgreens. Then I add to that kiwi, banana, avocado, a small amount of celery, a small piece of ginger, lemon juice. So this you can even add orange juice. I mean, fresh orange, not orange juice purchased at the market, but make a small amount of your own. The base for this can be homemade almond milk, or it can be I use both. I make homemade almond milk, and I also use organic raw coconut water, and you can just blend it up. Now, kiwi, I like to use the green kiwi for its high vitamin C. So this is more or less the green smoothie. If you have red microgreens and you would like to make a red smoothie, I like to make green and red smoothies. So yes, I use beets, we use golden kiwi, then I use strawberries. We can also use red dragon fruit. And what else? I mean, smoothies are easy. Pineapple would be great. Hey, you know what? Green apple should be added to the green smoothie. I forgot to mention that. So green apple peeled. Remove all the peels, please. Now, so the green apple for the green smoothie, and now I'll come back to the red smoothie. You can add peeled blanched carrots. You can also, I mean, you don't have to add all of these. You can add a few of these and see if you or your child, how you enjoy it, and you can kind of experiment. But yeah, so blanched carrots, blanched. I love purple sweet potatoes, and the sweet potatoes, I actually boil them. I don't just blanch them. Otherwise, they are a bit yucky. So I add those strawberries, blueberries, blackberries. I have honeyberries that I have tried, red currant. So these are all excellent. Remember to add in ginger. The base can be, like I said, and any kind of organic plant-based milk. I like to use almond milk. I prefer homemade. or you can even use camel milk, right? Those of you who are on the camel milk protocol, I have made a really delicious, but if you're using, actually scratch camel milk. No, cancel camel milk, because I'll tell you that. No, forget camel milk. So right now, plant-based milks and coconut water. Those are the two options I'm giving you, okay? So you have the red smoothie and you have the green smoothie. I make yellow smoothies, orange smoothies, purple smoothies. So I have to do a podcast on smoothies, I guess. But today, the goal was to give you some general ingredients. Obviously, you each have your own sensitivities, oxalates, etc. So be careful with all of that. And in your appointments, we can further kind of finesse your own recipe for yourself, your family, your child, right? But again, this was just, generalized information, the kind of smoothies that I use at home. All right. That's about it. That brings me to the end of this vitamin C podcast for today. All right, great. So I will be back here again with another episode of a lot of great educational information for you, which is good for your health, for you and your family, of course. All right, I will see you guys next time. Thank you for joining me. Be well. Namaste.
Thank you for joining Master Herbalist Dr. Jody A. Dashore, Director of the BioNexus Health Clinic and BioNexus Herbals, on the BioNexus Health Podcast, where we explore and share information and stories about recovering and healing from chronic and environmental illnesses such as mold biotoxin illness, Lyme disease, autism spectrum disorder, fatigue, Crohn's and colitis, mast cell activation syndrome, PANS, and more. Please help us grow our message by subscribing to our podcast channel and sharing the podcast on your social networks. For more information, visit bionexushealth.com.
Information within this video, audio, or text, collectively known as the podcast, has not been reviewed by the FDA. Nothing within the podcast is intended as or should be construed as medical advice. Information is for general informational and educational purposes only. Consumers of the podcast should consult with their healthcare practitioners for medical recommendations. Seek the advice of a qualified healthcare provider. Do not disregard the advice of a healthcare provider based on any information from the podcast. The information within the podcast may contain information concerning dietary supplements or over-the-counter products that are not drugged. Our dietary supplement products are not intended for use as a means to cure, treat, prevent, diagnose, or mitigate any disease or other medical or abnormal condition.